You want me to go ahead and start?
Let's see. Yeah, I think we can go ahead and get started.
Okay. Good afternoon, everybody. My name is Lisa Skipper, and I'm co-chair with the Consumer Decision Support Work Group, and I welcome all of you to the meeting today. Is there anyone new that's on the call today? Okay, since I'm not seeing anyone, you should have your minutes from our previous meeting that Amelia sent out yesterday for the September 27th meeting. And hopefully you've had a chance to review them. Are there any corrections or additions to the minutes? Do I have a motion to approve them?
I move to approve.
A second?
Come on, guys, I can't second it as well. So
I second.
Thank you. It's been properly moved and seconded to approve the minutes for the September 27th meeting. All those in favor?
Aye.
Okay, sorry. Those opposed? Motion carried. Okay, Amelia, back to you.
Thank you, Lisa. Hi, everyone. We are at the 5th meeting out of 7 of the Consumer Decision Support Work Group. So we're over halfway through our conversations, and it feels like we have a lot more to discuss, but we're going to do our best to keep the last couple meetings really discussion heavy. So for the agenda today, we're going to do a quick content review and really just jump into the discussion part. So I'm hoping we can save a solid hour for, just having this as the discussion heavy meeting. So just get right into it. First, just kind of an overview of what we'll be focusing on today. So we've done a lot of discussing the first part of the plan shopping tool, the consumer input pages. So picking up from last meeting, we're going to focus more on the second half of the plan shopping tool. So looking mostly at the plan tile display, how plan information is displayed in each tile, the sorting and filter settings, and then also picking up from the presentation from Washington, the prior meeting. Hopefully we'll have some time to really start considering how we provide tailored plan recommendations. So those are kind of the 3 main parts. Before we get more into some content for this meeting, I did want to follow up on one item from last meeting. There were a couple members that brought up the provider directory. We had some discussions in general about the provider directory that's incorporated into our tool. One in particular, we had talked about issues with the directory maybe not being up to date, and we had a conversation about that. And then the second part of it was an issue that someone brought up regarding how carriers send provider information. Sometimes the spelling's a little different. There's differences in case and punctuation. So the issue that comes up is when that's input into our provider directory, the directory is case sensitive, spelling sensitive, and it can create a lot of errors when consumers try to look up providers in the directory. So someone had brought that up as just something they wanted to bring out as a concern as it relates to the plan shopping tool. I hope I gave correct context for that. I think we have Nicole Edge from our plan management team who's on the call. Yes, Nicole, if you wouldn't mind just touching on that. We're not going to have a discussion about it, but I just did want to bring it up as a follow-up item from last week and have Nicole just kind of go through the issue and an overview of our understanding of it and conversations we're having to address it before getting started. So Nicole, if you wouldn't mind.
Sure thing. Thank you, Amelia. So just again, wanted to just briefly update you all on where we are with the provider directory search functionality. So one, we are very, very well aware that it's not a perfect process that we have. It's something that, of course, industry-wide is a pain point for us as far as the provider directory search. One of the concerns that we have that we're trying to figure out how to do is how to align all of the information that we receive from the carriers into the provider search and make sure that it's returning, or the output is where we want it to be. For example, one of the things that was mentioned is that a provider may be listed for one carrier as Mark E. Johnson, and on another carrier as Mark Johnson, and with another carrier, Mark Elliott Johnson. It just creates some difficulty for us for the provider search when a consumer is inputting that information, because depending on what they put in determines the output. One of the things that we would like to see happen and that we're actively working on right now is, regardless of what you put in, if you put in Mark, all of the marks return. However, that then creates a bottleneck for the returns that we get. So you have so many marks that are listed in the provider directory for all of the carriers. It then creates an issue with that return functionality getting kind of stopped up, because it's trying to filter and give you so many results. So that we like to try to streamline it as best we can, but it does create some difficulty. So we are working actively on how to figure that process out, as far as like name return. As far as sometimes the providers aren't listed underneath their individual names. Sometimes they're only a part of a group, and some of the carriers only put the group information and they don't put the provider's name outside of the group. And so if someone is looking for someone that is in a they want to search for a particular provider, it might not return that search result effectively, because again, they were only included in the group, or some carriers may have it listed outside of the group and some carriers may not. So that's some of the difficulty that we have with getting this information, is that carriers provide their own data to us in a file. We get that file, we upload that information. And so we're only as good as the information that we're getting. The output is only going to be as good as the information that we're getting in. So one of the other things that we're working on or talking about is how we can collect the data in a different way. So not using the file that we currently use, but maybe having an API call, which is a call between us and the carrier to kind of update that carrier information, and maybe make it a different set of data that we're looking for, only first name, last name, or only, first name, last name, and maybe hospital group association must include all the carriers. But again, those are conversations that we're having. We have to bring all of our carriers on board. We have to make sure that whatever process we roll out, all of our carriers are able to accommodate and give us that data in the way that we ask for it to be submitted to us. So that is a process as well. But wanted to let you all know that we are actively working on that and making updates as we see fit right now for the process that we have, to make it a bit easier and to make the return more effective. But down the line, we are having definite conversations with our IT team on ways in which we can improve the process.
Thank you, Nicole. Does anyone have any quick questions or any follow-up from that? Again, don't want to spend too much time on it, but did want to make sure that we provided some follow-up information on that issue, since that was raised last meeting, and it's a good point. Okay, hearing none. Oh, sorry, did someone? Okay, if anyone has any follow-up from that afterwards, feel free to bring it up, or you can always reach out to us after the meeting. But thanks again, Nicole. So we reviewed this slide at the last meeting, just giving an overview of some themes in the conversations from our prior meetings that have come up as they relate to the second half of the plan shopping tool. So some kind of major themes that people have discussed and wanted to look at more for consideration was generally ways to maybe simplify the plan tile and how we're displaying each health plan information. Another theme was the use of symbols and numbers when displaying plan information, which we've seen from research and literature that this is a best practice in how to communicate plan information to consumers. Improving how we maybe communicate the value of silver CSR plans over bronze. and then as they relate to gold plans, but just thinking how we're steering eligible consumers to all the financial assistance they might have available to them. And then hopefully we'll have time to discuss this at the end, but it's been brought up a lot even prior to the Washington presentation last meeting, the idea of providing plan recommendations to consumers, or maybe doing smart default to only show a subset of recommended plans based on consumer inputs. So just some major highlights from prior meeting discussions. So before I go to sharing my screen and we get into the discussion, I did want to go over some of the slides that we didn't get to last meeting, just giving some examples from other state marketplaces and how they structure their plan information and their plan shopping page on their consumer website. So first one, just wanted to revisit the discussion from the last meeting as well regarding the explanation of financial assistance page, where a lot of members here have just mentioned that maybe that page is not so consumer friendly in terms of the way our different forms of financial assistance are explained and displayed on that financial assistance page. So just wanted to throw out an example from Colorado, who kind of gives more a more prominent display and explanation of particularly the premium tax credit, which a couple members have noted is possibly a little policy wonky in the way we currently describe it on our MHC page. So the way Colorado describes it is they highlight the term lower monthly premium instead of highlighting premium tax credit, just as a more consumer friendly way of displaying that form of financial assistance. And then for cost sharing reductions, they highlight the term lower out-of-pocket costs. So it's just using more consumer-friendly language and maybe displaying all this information in a more consumer-friendly way. Wanted to just throw that out as an example. We've had this conversation at a couple meetings, and it is noted as a work group recommendation that we might need to look at our wording and our kind of explanation display for financial assistance. But this is just an example from Colorado on how other states may do it differently. Next one. There's a couple of slides coming up just giving some different examples of variations in plan tile display and how different states display their plan information on the plan tile. So I'm going to go over some specific examples, but feel free to look at these too as just different ways that plan information is displayed state by state. So for this first example, we have Maine. They not only include a total cost estimate, but they include different variations. So cost in a good year, a balanced year, kind of average year, or cost in a bad year, which is something that other states do, is giving different scenarios of, different years of healthcare utilization, low, medium, high utilization, and cost estimates for each. This is also, the way Maine does it, it's also a pretty good example of the use of color and symbol to highlight information, not just using like dollar numbers to highlight these kind of important parts of plan information. So a couple things on this plan tile from Maine. Next one, Pennsylvania, just another example of the use of color, the use of symbols to highlight important plan information. So for this one, highlighting cost estimates for plans, not just showing a total cost estimate, but giving color and symbol to it to show is this lower, medium, or higher cost plans for a consumer. Another plan tile display example, again, with total cost estimate. This one is from New Mexico. And in addition to the total cost estimate, they also provide right below it a more prominently displayed explanation of how that cost estimate was calculated, just to provide some maybe more succinct transparency to consumers about that. There's been some feedback, both from Washington, I think from a couple members here, of there's confusion sometimes from consumers when they don't understand how total cost estimates are actually calculated. So this is just an example of a disclaimer on one of the plan tiles of just briefly explaining to the consumer how they came to that number and how they came to that estimate for each individual plan. Next one is just some examples of different sorting and filter options and how they're maybe displayed on the plan shopping page. So Pennsylvania on the right, there's an example of how they show their sort and filter options, which they're just prominently displayed on the page at all times. We'll navigate to this page, but we'll see on the MHC site, you have to click a button and it's a drop down to show all the filter options and all the sorting options, versus the way Pennsylvania does it, where it's just laid out on the side of the plan shopping page. So it seems to be a more obvious thing that is more noticeable to consumers. And they highlight it as a more an important feature of their plan shopping tool. And then New Jersey on the left, the way that they show how you can filter plans by metal tier, they give the list of metal tiers, and then they also provide those really quick explanations of each metal tier. So for example, gold, they explain it's a high premium, lower deductible plan, versus bronze, which is a lower premium, higher deductible plan, just so they're giving some small disclaimers to consumers, even on the filter options. California is an example of a state marketplace that does auto filter plans based on consumer inputs to only show a subset of plans to consumers based on what the consumer is inputting from income to healthcare utilization or expected healthcare utilization. So they don't provide plan recommendations per se, but they do auto filter plans to only show a subset of plans, and then consumers can opt in to choose to see all the plans available to them. But it starts with kind of default sorting or default filtering for a subset. And then the last slide is just overviewing what was discussed with Washington last week. Washington's an example of a state that actually provides plan recommendations, which they call their smart choice plans. So consumers can use their consumer decision support tool and can end up with up to 3 recommended plans based on all their inputs. From the discussion and the presentation that Washington gave last meeting, the smart choice plans or their plan recommendations factor in net premiums. Oops, sorry, I think there we go. There we go. Washington, for their smart choice plans, they factor in net premiums, they factor in estimated out-of-pocket costs, and then they also include some weighted scoring for provider networks and pharmacy coverage, depending on what consumers input. So same with California. For these plan recommendations, consumers are always able to see the full list of plans that are available to them. But if they choose to get a little more assistance from their plan shopping tool and get some recommended plans, they'll see those first, and then they'll have all the other plans available to them below that. So I will stop there. Did anyone have any initial thoughts or wanted to look at one slide in particular a little bit more before we get started? Okay, hearing no comments, I'm going to go ahead and stop sharing my screen. We'll navigate to the plan shopping tool and we'll just kind of get right into our discussion. Go ahead and do that.
If I may, just a minute, Amelia.
Oh,
I think that's the link I was looking for, so that I can provide some feedback, right?
Oh, our actual.
Yeah.
Okay,
Yeah.
sure.
Yeah.
Yeah.
Okay, just because I'm out of my office, and if I could use this week to review it, that would be awesome.
Sure. I'll include it the link in the message section in a second, and then I'll send it to you as well.
Okay. All right. Thank you.
Everything.
Thank you.
All right. All right. Can everyone see my screen okay? See if I can zoom out a little bit. Okay. So just what Carmen was talking about, this is, we've been talking about our Get an Estimate tool, our consumer decision support tool. We're on that now. I've kind of skipped through the initial pages with the consumer inputs, which we've talked about in prior meetings. And so we've just gotten straight to the plan shopping page. So we're at the page that consumers get to once they've input all their information, and can now see the full list of recommended plans available to them. They can see their estimates for financial assistance, including tax credit and state premium assistance for young adults. And then we get down to the actual plan list page. So we have our list of plans here that consumers can scroll through, quite a few. So I think what I'd like to first start the conversation with is just, again, looking at the plan tile displays. So we'll give this example here and we'll use this in this discussion. We have a United Healthcare Bronze plan. We have all the information on this plan tile is the same as every other plan. So I think maybe to start, if we just want to take a minute to look at what's displayed on the plan tile, and then if we can start the discussion with feedback from members. We've had, feedback on this before, but could we just kind of have like a throw out what you think are most important parts of plans that consumers really want to understand about each plan? Is it, do consumers value most what providers are covered? Are they mostly looking for specific providers and plans? Are they mostly looking at costs? And is that premium? Is that total cost? Are they looking at any parts of the deductible? So could we just kind of do a little bit of that to start? What's some feedback on our understanding of what is most important to consumers for plans and what we think should be highlighted on a plan tile? So opening up the floor, and don't be shy, just share your thoughts.
As a navigator, when I'm enrolling people in or looking at plans, one of their big concerns is, especially if they have chronic conditions, what the plan is going to cover. So like if they're diabetic and they're taking insulin, they want to make sure that the plan that they enroll in is going to be one that's going to cover the cost of their prescriptions, and then what it's going to cost for doctors or specialists.
Thanks, Lisa. That was you, right? I couldn't tell.
Yes. Sorry.
Great. Yeah, no. Thank you, Lisa. Yeah, great point. We've had some discussions about considerations looking at subpopulations and making sure that we're taking into account the needs of subgroups, like people with particular conditions or high healthcare needs. Do they have tailored information that they need when they're plan shopping, or are there ways to accommodate that so that we're providing that information in a more accessible way? Tom, go ahead.
Yeah, I was thinking the same thing in the line of specialist. I think that's an important feature since most people use a specialist. ER services is of course important, but it's not used as by many. And if you're going to go to the ER, you're going to go to the ER, right? If it's for a medical emergency.
Thanks, Tom.
I would also say maybe generic and preferred drugs are the two biggest ones that people are looking for cost.
Okay, and when you say that, you're saying it's like making sure that if someone inputs a prescription that they know whether or not that's covered under a plan. Is that kind of what you're getting at?
As we're looking at the cost share, right? I guess those commonly used cost shares that most people would encounter, right? So most people would encounter a specialist visit before they encounter an ER visit. And then generic and preferred drugs would be the ones that they would probably want to know the most about as far as the cost share in making their decision.
Gotcha. Okay. Yeah. Thank you for that. That's good input.
The total yearly cost estimate, is that the...
Say that one more time.
What was the total yearly cost estimate per household? What does that dollar amount represent?
So the total yearly cost estimate, we have incorporated into our plan shopping tool a cost estimator that, and maybe someone else from the exchange could speak to this a little bit more, but we take all the plan information, we factor in the premium, deductible, cost sharing, all those kind of like cost details of a plan. And then we use that with consumer input. So the consumer's age, their expected healthcare utilization, I think a couple other factors. And there's a whole, similar to how Washington provides a cost estimate and then plan recommendations, we have a similar aspect of our tool that can provide total cost estimates based on plan information and consumer inputs. And so that's what this total cost estimate is here. And when you hover over this, it gives a little bit more of an explanation of it. So again, it's factoring in the premium, the deductibles, and expected cost sharing with co-payments and other costs based on consumer inputs to get that total cost.
And is that per individual? Well,
it would be for this one, it's individual because I just input information about myself into this one. Yeah. So for this is an individual cost estimate. I believe when you put in household information and there's multiple people eligible for QHP, it would give a cost estimate for that household.
Oh, okay, cool.
Joan, you have your hand raised?
Yeah. So one of the things that as a Navigator program, we get a lot of questions about the prescription copays, and we have a tool that we work off of, which would be really helpful to have visually to understand if the prescription copay is before a deductible or after a deductible. So some of the plans have, you know, a $2,000 prescription deductible where people have to meet that first $2,000 before any of their prescriptions are covered. So it would be helpful to have that visual here to understand if there is a separate prescription deductible.
That's a good point. Maybe Nicole, if a plan has a separate prescription deductible, do you know if that's included on the plan tile or if that's shown currently?
So it's not shown on this plan tile here, but when you go into the details of the plan, it's listed there. So you have the prescription drug deductible. If there is, like, if there's a separate prescription drug deductible, it'll be noted there. And you also have the breakdown of the 4 tiers of prescriptions as well that's available on the details page. So yeah, if you see here, yeah.
Yeah, is this, yeah, so I'll just go through that one more time. So Nicole just mentioned when you click on at the bottom right of each plan tile, you click on the details page, this information pops up, which is a much more detailed overview of the plan information. So if you scroll down a little bit, it goes through some of the plan information a little bit more, and then we get to the cost sharing overview where it does show what the deductible is and then what the prescription drug deductible is if there's a separate prescription drug deductible for the plan. So that information,
include that on the front page for those plans that have a separate RX deductible.
Say that one more time, Tom.
Is there any way to include that under the deductible section when they do have an RX deductible? Because you might get the impression that this plan has no deductible because it's not, it's just saying annual deductible. It's not saying annual medical deductible. It's not separating that out. I know CMS last year updated healthcare.gov to combine that and break it out when there was a $0 medical deductible and an RX deductible.
Okay, thanks. That's interesting. I'll look at that and maybe I'll share that after the meeting as I don't think I've looked at the Federal Exchange and how they, but I'll look into that. And are there any other thoughts on this subject? So hearing feedback from a couple people that deductibles for prescription coverage is important to a lot of consumers, and it is not necessarily included or explained in the plan tile display whether or not there's separate deductibles for medical and prescription, but just considering whether that might be something to add to the plan tile display. Any other thoughts on that?
And then I would assume, just going back to the other question about the deductible, that if the copay or the coinsurance was subject to the deductible, it would include that in the language.
Yeah. Okay.
Yes, that's correct.
Yeah, one thing I don't like about the SBC is it's, you know, they have a little disclaimer, it's after the deductible's been met, so it can be very confusing for a consumer to know whether or not a deductible applies or not. So
that's a good point. Thanks, Tom. Thanks for all the feedback. Allison, go ahead.
Yeah, my impression of this plan tile is that it just seems to have a lot of fields. I mean, I'm counting 13 variable fields starting with quality rating down to telehealth. I'm not sure what, you know, consumer user testing would show as far as, you know, what's the optimal number of variable fields before someone gets overwhelmed. I mean, this is something that's, you know, preference sensitive, but I feel a little overwhelmed looking at this. And I'm wondering if, because it's, you know, we can throw out benefits that are particularly important to certain shoppers. I think we're all going to have different views on this, but I wonder if by simplifying the tile and making the details button a bit more prominent, where it's easier to navigate to, you know, find those details. If you're interested in a lab visit copay, or you want to know the drug deductible, you can easily find out where to get that information. And then I think the links as well, it just kind of adds to the amount of information where perhaps that could be part of the details page rather than on the plan tile. I don't know. It just strikes, my first impression of this is that it needs to be simplified a bit more. And even, you know, you can look at how things are arranged to increase the simplification using font size and bold type as well.
Yeah, that's well noted. Thanks. Maybe I'll just going down that line, if anyone agrees with that thought, that there is room to simplify how much information is displayed on this plan tile. Any other members who kind of think similarly, have a different opinion, or appreciate I do appreciate that input, Allison, just broadly, like it does seem that there's maybe too much information, not necessarily considering what should and should not be there, but just generally on first glance that maybe it's a little overwhelming. Anyone else have any other thoughts about that? Joan?
I totally agree. And as I'm looking at the presentation with some of the different approaches to this, I mean, I love a sort of a vertical, almost bookmark approach with the key fields there, and perhaps an explanation on the left, you know, to help guide a little bit. It feels very overwhelming to me as a potential user.
Thanks, Joan. Yeah, okay. So in line with Allison's comment, kind of an overwhelming amount of information. Any other comments in this line? Steve, go ahead.
Yeah, I would just say try to be more consistent with the data that you're showing. So for example, some of this has cents showing, some of it has commas, some of it doesn't. So for example, the annual out-of-pocket max, there's no comma in between that 9 and the 4, but then you've got a comma for the ER service. You've got cents showing for some of them, but not others. So I would try to be more consistent with the number values.
Okay, thanks. Yeah, that's a great point. That's actually something I've never noticed, but that's a good point. Other thoughts in this line?
That could be, it could be that way based on how it's filed on the PBT. I think that's why it might be coming in that way in that format. To me, I guess more information is better. And then if the member doesn't, feel that that information is important to them, they'll just discard it. They might only look at this one page. They might not go any further than this page. So if we reduce it, everyone should know what their deductible and MOOP is, right? Because that max out of pocket's important when you're comparing across, especially mental tiers. So.
Yeah, it's definitely a balance.
I don't know how important the telehealth information is. That might be, again, something if you were trying to, again, make it not look so crowded. Maybe the telehealth is information they can get access to, somewhere else, or a link.
Yeah. Maybe Nicole, could you speak to this more? I think telehealth was, everything has a history of when and why it was included. Telehealth was probably during the height of the pandemic and wanting to highlight telehealth as an option under plans, and maybe some plans are more generous in terms of their cost sharing for telehealth. Nicole, did you have any other context to that? Why telehealth is displayed?
Yep, sure. So just another thing I think Tom touched on when we talked about some of the discrepancies in the way that the numbers are displayed or the values are displayed with commas and no commas. So that is, we upload these dollar amounts directly from, the information that we get from the carriers on a template. So we really don't have a ton of control the way that's uploaded. I think we can definitely take that back and see once it's uploaded if there's anything that can be done on the back end. But that's why there's that discrepant kind of display there. So just wanted to give a little background about that. And then for the telehealth, and so this is something that came directly out of some concerns that were shared with us from some of our consumer assistance workers when consumers were selecting plans, that a lot of them were virtual forward and telehealth plans that steered consumers to kind of seek out virtual care first. And so there may be different deductibles. For example, primary care, if you go into a brick and mortar, you go into the doctor's office, physical office, there may only be a $50 copay. A $50 copay if you're seeking virtual care from a primary care doctor. So I, reach out to my primary care doctor, I schedule a visit. I'm on a virtual forward plan, and that might be a $0 copay for that virtual visit. However, if I go into the physician's office, the physical office, that might be a $100 copay. And so we got a lot of feedback from a lot of our consumer assistance workers who felt like they had consumers on these plans and they weren't aware of this. The information was buried in the SBC, and there was no prominent display that there was going to be a difference between a virtual visit and an in-person office visit. And so after receiving so much feedback, we had to try to accommodate having a display, a more prominent display, to let consumers know if there was a difference between the two and what that might be. As you can imagine, it's kind of difficult to go through and only display the ones that have a difference. And so this was the happy medium of providing that information on the plan tile so consumers had it readily at hand. So that's just a bit of background about that. It's actually something fairly new that was added. And again, it was in response to a lot of virtual forward or telehealth forward plans.
Thank you, Nicole. That's super helpful context. Joan, did you have a comment?
Yeah, and again, as I just sort of look at this as a visual, it again, it feels overwhelming, and it also is assuming that someone has a certain reading level, and it's like reading a book, where you're going left to right and you're trying to take this all in. Perhaps if the information in the lower half were in tiles of its own, and or there's one large tile, a vertical tile, and then on the left there's some other tiles, it would, I think it might be interpreted a little bit more easily. But the information is important, and I agree about the telehealth, but if it had, it's a tile in terms instead of like a text, it might be more clear. And it's also unclear. You've got telehealth, primary care, $50 copay. Then you've got urgent care, $100 copay. Is that a telehealth urgent care, or is that, you know, so it kind of is to me, a run-on sentence, because I don't think it's all part of the same conversation.
Okay, so you're saying you can tell, like, primary care, it's clear to you that this is a telehealth primary care copay, but it's not necessarily clear that this is a telehealth urgent care.
Well, and the question, I guess, is it? Because above, on the tile above, it says urgent care 100. So is it repetitive, or is it a different category?
Yeah. So to be clear, all of these are copays, telehealth specific copays, okay, which are separate from the ones up here. And to Nicole's point, there was a lot of consumer confusion when some of the like telehealth urgent care copays were different from the in-person office visit urgent care copays. These ones are the same on this plan, but yeah, confirming that those are all telehealth at the bottom. And maybe that's a consideration if that's not clear. I think to your point, the in-person visits, the copays listed are kind of separate in their own tile versus at the bottom here where it reads a little bit differently, even though it's similar information. And so maybe that's causing confusion, and maybe there's a better way to organize that information on the plan tile.
Yeah, I would agree with that. Thanks.
Amelia, I like the, when Jen was talking about tabs. I mean, I know that there's some of these things that are specific that should be on top, but you know, if you're breaking it down where they can, and I don't know how difficult it would be to set up each plan where you have different tabs where you're clicking into them to see the more information on like urgent care. A point to note on urgent care, because I've had consumers that when they came in to see me and they were out of the area, and they went to an urgent care and then they didn't have a flat copay because it was out of network. So they got a full price of whatever an office visit was there. And I don't know that it specifies that in the plan shopping or in details or anything that tells someone that if it's not serious enough to go to the emergency room, you may incur the full cost of an urgent care if it's out of network.
Yeah, I'm not sure if and where that information is explained. If that's, my guess is that it's not easy to navigate to just from this plan shopping page. If anyone else has any more information on that, but that is a good point.
So just quickly, Amelia, so no, it's not on the plan tile, and I think that's definitely something to take back, especially about the in and out of network, or making sure that it's noted here that all of these copays are in network, but on the detail section, again, there's that in and out of network breakdown for urgent care as well.
So I'm clicking on the details page again. So scrolling down. And again, there's a lot of information when you click on this details tab, it has all the really descriptive information about each plan. And so a lot of this conversation we're having is what of all this, like, you know, it's really dense information. It's a lot. What should we be displaying prominently on the plan tile? But going down, Nicole, you said that there's information about in and out of network.
Yeah, if you just pass by urgent care, if you scroll back up a little bit more, yeah, right here.
Yeah.
And so all of the services on the details page, you have your in network and your out of network, out of pocket costs.
Could there be disclosure on that page that says in-network cost only or something?
Are you like when we're looking at this part right here, just
Yeah,
clarifying
exactly.
that these copies are in-network? Yeah,
Mhm.
that's a good point. Yeah. Anyone else have thoughts on that? If that's maybe, if you know, the tiles are what they are right now, but as we're considering how we might be reorganizing them in the way that they are now, is it helpful information? Is it important information to maybe include that disclaimer about just noting that these are in-network co-pays? Is that important information to prominently display, essentially? Any other thoughts on that? Okay, well, I think, again, this is all just such helpful feedback. I'm going to make a more of a point to really condense the discussion today and send out just an overview of what was discussed and people's thoughts for consideration. Essentially, I think kind of one of the main takeaways was a lot of you feel that maybe this is too information dense, and that there might be ways to prioritize what information is displayed so that it's simpler on this initial plan tile. And maybe looking at how we restructure how the information is displayed. So just kind of looking at the top half where you have each category divided pretty clearly, and then you get to the bottom where it just reads a little differently. And so it may be a little hard to digest this information. Another couple of things I want to focus on and get some feedback on. So one of the themes that we've talked about and that literature reviews that we've gone over from prior meetings really show consumer-friendly ways of displaying information, use symbols, use colors, rely less on numbers, dollar figures, and wordy text, but kind of use of different visual tools to make information a little more digestible. So just kind of based on what information is displayed here, some major one, we know that we're going to always be prominently displaying premium and the deductible and those kind of major parts of a plan and the plan information. Would love to get your guys' thoughts on how that information is currently displayed, just in terms of how we're highlighting it, if we're highlighting it well, or if it's getting kind of lost in all the other information that's on the plan tile. What are some thoughts about kind of the important parts of the plan, like the plan name and the total estimated cost, the net premium, the metal level, those kind of major parts of the plan and how they're displayed? Is it displayed well? Is everything kind of, you know, maybe a little overwhelming, or are there ways that we can be highlighting different important aspects of the plan better? So opening up again with that question, if we can share some thoughts. So for example, maybe I'll go back to, let me share the slides again real quick, just so we can look at some of the examples from other states and then go back to this really quickly. So some of the ones that we went through in the beginning, looking at a couple of these, we have Maine. They're examples of how they use symbols, of how they use colors when they're displaying cost estimates, and displaying that really prominently. Robin, go ahead.
I was gonna say, when I saw this page, and this is maybe the overall layout, like I felt this was a little for me, a little cluttered, and maybe that's just the way I view things. And I don't know if I understand, like, if as a consumer, I would immediately understand what it meant by a good year and bad year.
A good point.
There was one, I think it was New Mexico. It was a little further.
Let me, they give the disclaimer about what the total cost estimate is, and they display that on the plan tile. Is that what you're referencing?
Yeah. Just for me, and I'm not necessarily the person we're evaluating for this, but I thought this was simplest on the eye.
Mm-hmm.
And trying to, I know it doesn't quite get to the concept though of kind of the range of potential out-of-pocket costs you might have.
Yeah, I think, yeah, to your point, this is kind of the other side of the spectrum where the plan tile is really simple and doesn't include any specific information. And so you would have to click on the plan details to get into any, nitty-gritty stuff that you'd want to look at. So just thinking about this and looking at this plan tile and how the information is just much more condensed and much more simplified versus how we're currently doing it. It's just something for consideration. And then also thinking about, so when we're doing total estimated cost, I mean, there was a question on this call just asking for an explanation of what that is. And I'll navigate back to our site in a second, but I think to Tom's point of just kind of like wanting to understand what the total cost estimate is and how we got to it, maybe we could look at that one more time and consider if that's clear the way it's laid out in the plan tile and that we're providing transparent information about that, and maybe if we should be providing a little bit more. So I'll just note that for if we could maybe circle back to that in a second. So just a couple of the other examples, again, just reminders how other states use colors, how other states organize their information, what information is on it, and just the general layout, looking at consumer friendliness. I think someone mentioned the display that looked more like a bookmark tab, and I think we're referring to this one with Pennsylvania and how they display their plan information. It flows a little bit more kind of up and down. There's less needing to look from here to here. It's just your eyes kind of go up and down. They have a little bit less information as well that they display in their initial plan tile. And they do use color and symbols more when they're highlighting important aspects of the plan, like the total estimated cost or the net premium are really important parts of the plan information that consumers often look for. So bolding that with colors and differentiating higher, lower cost plans with colors is a really helpful consumer tactic when you're displaying information. So just wanted to look at these again. I don't know if anyone has any other comments on them or wanted to look at one more just to note anything in detail from any of these examples. If not, I'm gonna. Oh,
the
go ahead,
example
Tom.
where you had the three different sort of,
Estimated cost, good, bad, yeah.
I like that because of, again, what you mentioned earlier, that someone who might buy a bronze plan because it's cheap doesn't recognize that, hey, if it's a bad year, what they could pay out of pocket versus a silver 94, right?
Mm-hmm. Yeah, that's
in this way they could compare that.
Yeah, that's a really good point. And I think we'd had that discussion when we were looking at the consumer input page where the consumer has to or has the option to check if they expect to be a low, medium, or high healthcare utilizer. I remember there was a discussion that it doesn't take into account the nuance for a consumer. Maybe the consumer doesn't understand they might be a low healthcare utilizer, but what happens in a given year if they break a leg or they have an unexpected healthcare issue that has high costs associated with it. So when you're when you are estimating your average utilization, not considering that, to Tom's point, when you give different cost estimates in different years, a good year, a balanced year, a bad year, that might kind of get to that issue when we were talking about the healthcare utilization page. Robin, go ahead.
Just maybe a question or something to explore about consumer literacy. It's interesting that they give like an actual amount. Another approach would be like flagging that you could be at risk for higher costs if you're sick that year or have lots of costs. In other words, doing it through words and maybe not giving an estimate. I don't know what the impact would be on the consumer. If that's a simpler way to do it, or maybe some consumers would respond to the graphics more. So just kind of raising that as a question.
It's a good question. It's a good point. I think there's been emphasis from other members that is important to try to highlight at some point to consumers, just as we're trying to give information for their consideration of how they're choosing a plan. Is that maybe something that should be included as a disclaimer somewhere of, hey, you know, you can only estimate your expected utilization so much. Here's what happens in an unexpected event. Just giving that disclaimer of how that impacts your healthcare costs in a year. And maybe that's not on the plan tile displays or on the plan shopping page, but maybe that's incorporating that kind of disclaimer or notice somewhere else in the plan shopping tool, maybe on the prior pages that we've discussed before. Any other thoughts on that, or other members who've kind of brought that topic up as something for consideration? Any thoughts?
I kind of like the tile that you showed from Mexico, where it didn't have a lot of information, but then, right there in the center where it's saying see plan details and additional information. So you're showing them what the premium's going to be, their deductible, and what their out of pocket, the cost there. But then you're driving them to look at the details so that they get more information and maybe be more informed about the plan that they're enrolling in. Because I think sometimes when, kind of like ours right now, the sample that you were showing from United Healthcare, where it's saying that zero deductible, and if they don't go into the details, they don't know that there's a $5,000 deductible for brand name prescriptions on that plan. So they're picking a plan thinking, okay, I have a zero deductible on a bronze plan, but if something major happens, I'm going to have $9,000 something spending it out of pocket. And so, I think part of it, when they're shopping themselves, they're not coming to see an assister or a navigator or someone that can give them more details or go over more details when they're looking at it by themselves. Then they really need to be able to understand that if they go to the plan details, it's going to pull it up more.
Yeah, all great points. And I think you're right that this tile, your eyes are drawn a lot more to the C plan details, which I haven't clicked on it, but I would assume that it's similar information displayed when you click the C details on our page and for the plans on MHC. And then they complement that more prominently displayed plan details button with less information on their plan tile. And then I think further to your point, Lisa, is when we're giving information about copays, et cetera, it's crowding our plan tile, and it's a lot of information. It's all really important information. And I think this conversation is about considerations of how to balance that. But when we add information about a specific copay, it doesn't include disclaimers about, well, that's for, you know, in-network, or that's telehealth versus in-person, all these things that you would have to go through a navigator more than likely to kind of break down and get that further information. So just thinking through, you know, what information is displayed and if that creates confusion in different scenarios, because we can't give all the caveats and all the details of that in a plan tile. I think that's probably important for consideration. Unless there's other thoughts or you want to look at one more of these slides, I will go ahead and navigate back to our plan shopping page just so we can close out the conversation about plan tiles. So last call for any comments on the slides. All right, I will navigate back to our page. Okay, so back on our plan tile, just having kind of like refreshed our memory about how maybe some other states are organizing, displaying their plan information. Anyone have any other thoughts about comparing how Maine does it, how New Mexico does it, how Pennsylvania does it, the way we saw it, and updated opinions or comments about how we're currently displaying? Allison, go ahead.
Yeah, I have a question just about looking at once this does change. Are you envisioning that the exchange would use the same structure here and just add or remove fields, maybe change some of the graphic design, or is there potential to totally change the structure? In other words, for example, adding a row of 3 tiles versus 1 tile. I'm just curious kind of what's within the realm of possibility for making changes, because I think that would also help us to kind of envision how we would change this, you know, whether it's an overhaul or just working within this current structure.
Yeah, I'm happy to try to speak to that more. I really think I don't want to put limits on what's possible. Obviously, larger, more reformative changes would not be in the next year, in the next 2 years. That's a longer system change. But I wouldn't want to limit the conversations here and what's possible in terms of what the work group is discussing. You know, some things that we discuss that we think are best practices may not actually be feasible, but I would still not want to limit that conversation. And we don't, you know, this is more to inform our considerations in the next couple years. So I would say I wouldn't want to limit what's possible and what we're discussing. And if you know, we're having discussions and something's just not feasible, someone from MHB can always speak up. But I hope that's kind of helpful level setting, Allison, and for the group, that we don't have to limit these discussions to what we think is and is not possible.
Definitely, that's really helpful.
Okay, so maybe we can probably close out this conversation. Maybe just spend another minute or two. Are there any other thoughts on, just given how, like, some of the other examples of what we've seen for planned tile display, how are we doing in terms of how we're displaying the information that we think is important to consumers? Does the estimated premium stand out? And does the information read clearly? Are there areas where maybe we could be using colors and symbols a little bit more to highlight information? Any other feedback on some other points that something you saw from other states that seemed to jump out as a good practice that maybe we're not doing, or maybe we could incorporate more. Any other thoughts?
I do think the formatting for estimated monthly premium, it just, even though it's in that blue box, it just doesn't stand out as much as I think it should. It gets a little lost. So I think making that more prominent would be a good step.
Thanks. I do agree, Allison. I wasn't trying to point to that too much, but it seems like there's other states that highlight it better. Your eyes are drawn to it, and it's a little more obvious than the way we do it. What about, just one more question, the total yearly cost estimate? Let me highlight it really quickly. Are there any thoughts on how this is displayed, and is it displayed prominently? Should it be displayed more prominently? Any thoughts about that, Robin? Go ahead.
This may be going back to that New Mexico example, but I think the parts of what kind of gets added up is displayed more prominently, and it's almost like the total yearly estimate's almost like a footnote, and I think it gets lost in this format.
Yeah, thanks. I think I would agree with that.
Yeah.
If we were, there might also be considerations for how we're explaining what the total yearly cost estimate is, but do we think that consumers value that estimate and would want a better understanding of what that is, and for that to be a little more obvious on plan tiles, similar to maybe making the premium display a little bit more prominent? Is that a consideration for these plan tiles for our total cost estimates, that maybe it should be more prominent, maybe it should have a little bit more of an explanation? Anyone else have any perspectives on that, or agree, disagree? Okay, well, what I will do is, oh, Robin, go ahead.
Just food for thought. I think you're trying to balance, or the exchange is trying to balance all the information about what goes into the annual cost, estimated annual cost. And like, it's almost like you can either give a lot of detail on that or flag more about kind of the range of risks that someone has, but it's hard to do both visually. And so I'm just making, not saying which is most important, but just making an observation that it may be one or the other when you're displaying something.
Yeah, good point. There is limited real estate, and it's definitely a balance of what we're displaying and what maybe we need to embed into like plan details or something like that. Joan, go ahead.
Just thinking that it's, this is a tough number to get to. And if there were a link to estimate your individual, yearly cost estimate, and there was just a simple worksheet that had your monthly premium, maybe it even would field right in, and then you had doctor's copays, times 3 or whatever, just something to help people understand where those numbers come from.
Yeah.
That may be just a useful tool to make available, and I don't think it would be that hard to do. So,
and when you say tool, do you mean, so the way the tool works now is it mainly uses that healthcare utilization question to estimate, like it'll, you know, give your cost sharing estimates. So it's not tailored specifically to each consumer, but it's kind of like a broader estimate. And your suggestion is maybe building on that to provide a tool where consumers can be a little more detailed in their inputs. Like for their total cost estimate, they want to estimate for two primary care visits and like one urgent care or something like that. Is that what you're getting at? Just like trying to get a little more, yeah.
It might have, the ones I've seen have, you can go by month of the year, or just have a number of columns, but it's generally primary care visits, specialty care visits, prescriptions. So someone can really identify how much they would pay each month for their generic drugs or their specialty drugs, and see what the total would be.
Yeah, that's a great thought. I cannot speak to the feasibility of that, but I will definitely, I'm happy to take that back to discuss more, because that is, I mean, it's, yeah, the idea of providing a more tailored estimated total cost,
right,
more specific to consumer. Yeah, I think that's an interesting thought, and it's a great point. Thanks.
Yeah.
Allison, go ahead.
Yeah, I liked that thought as well. Joan, were you thinking that would be something separate and therefore you could remove that field from the plan tile? Or are you thinking it would stay? Because when I look at yearly cost estimate, I wonder if most consumers understand that, and if it's something that's so tailored to consumers that are, have a particular scenario in mind, and maybe it's a separate tool for them, but it's something that could be removed from the tile just to make sure we're using the real estate efficiently.
Yeah, it could have a button, and may not need to take up a whole tile, but to estimate your personal, yearly cost, click this link for a worksheet. And that way it could, for people who really like drilling down and having numbers in front of them, it could help them really understand like how much they will pay for prescriptions a year, and how many doctor's visits and specialists and so forth.
So I just want to say really quickly to everyone, this total yearly cost estimate only populates on the plan tile if you input the information prior to this. So on that screen, I'm not sure if we looked at that screen today, but I think Amelia has gone through it in the past for utilization. So you have to fill in that low, medium, high in order to see that. So if you don't click this information and you skip it, then you don't see that total yearly cost on the plan tile.
That's a helpful clarification. Thank you, Nicole.
Agreed. Thank you, Nicole. Yeah. And Nicole's referencing this page. This is the page right before the plan shopping page where you can input your expected healthcare utilization. Well, again, we are at time. So I think this was a great discussion. Before I send out follow-up, I will condense this discussion so we hit the main points of what was brought up and considerations and perspectives, just to make sure that we have that you can read through after this meeting. So for next steps, just go to our slides. This was the 5th meeting. We have 2 more meetings after this, so we are kind of getting close to wrapping up. I will send these slides out one more time. So you'll have all these state examples. And then a reminder too, that I always include a slide that has the links to all the other state marketplace plan shopping tools. So all this information I pulled from all these different sites, you're always welcome to use any of them and look through any states for comparison. And then for the next 2 meetings, we'll have our 6th meeting regularly scheduled in 2 Wednesdays from now, October 16th at the same time. This will likely be our final work group discussion. So I will condense everything we've talked about, and we will make sure to go through any points that seemed of interest to members or seemed important in terms of what we've highlighted and prioritized in our discussions. And then we will spend the last half really diving a little bit more into plan recommendations or the idea of auto filtering based on consumer inputs, so we can get some ideas from the work group as we're considering those ideas, providing tailored plan recommendations to consumers. So that'll be the next meeting, which will be really our final discussion. I will try to have an initial set of work group recommendations based on our discussions that we can try to go through as well, just so we can get some initial input on that. And then the 7th and final meeting will be reviewing the recommendations, confirming and finalizing them. And that will be the conclusion of this work group. After that, we'll take the official work group recommendations to our standing advisory committee so that we can present them. And then I'll follow up with, you know, expectations of what we plan to do with these recommendations. You know, moving forward, what we can expect from the work group outcomes and what we ultimately recommend in terms of improvements to our consumer decision support tool. I'll note too, the 7th meeting, we've updated the date and time. So instead of our regular Wednesday, our last meeting will be on a Tuesday in October 29th. So it's the end of the month. So we'll wrap up now, and I will resend the calendar invite for next meeting, October 16th, and I will resend the calendar invite for the updated last meeting, which will be October 29th. So that's the follow-up from this meeting. I think we can go ahead and wrap up. Are there any final thoughts or comments? Okay. With that, we'll conclude the meeting for today. Thank you guys so much. I think it's been a lot of really great input, and always appreciate everyone who's able to join and just provide all this really, really helpful food for thought. So we'll continue the discussion in 2 weeks. And thanks again, everyone, for joining.
Thanks, Amelia.
Thank you.
Thank you.